Thank you so much for hosting, Amy, and thank you to Anshe Emet for having me again this year. It's an honor to be back. And I just wanted to say that I know some of you have questions that we were talking about it before about your unique circumstances. Someone had federal employee health benefits, for example. And easiest way to talk about your situation one-on-one, if you don't think it'll pertain to the group, then simply make an appointment with me. We can have a 15-minute one-on-one. There's no charge, of course. It's entirely free. And you can use that link to find the time that's convenient on your end if you want to talk about your situation more one-on-one. So please take a look at that link. But interruptions are more than welcome if you feel like your question would pertain to the group as a whole. With that, let me get started. First, I want to introduce myself. My name is Ari. I'm the co-founder and head Medicare advisor at Chapter. Here's a picture of me and my wife from our pandemic wedding. We just had a wedding celebration 2 weeks ago, and it was such a simcha. But this is what we were able to celebrate with our grandparents back in August 2020. And here you can see our nanas together, and that's Molly's nana and my nani and my nana. If you want to call and you don't want to book an appointment, then my number is listed and also my email address. And of course, you can visit our website, which is askchapter.org. What is Chapter? Chapter is a Medicare advisory that serves thousands of older adults. There's no charge to work with us. And if you want to make a personal appointment or set up a one-on-one consultation to discuss your situation in detail, simply drop your name in the chat, or you can just click on that Calendly link and it'll offer times that you can book. I want to go over, I'm sure you're wondering why should I trust Chapter? Well, first, I'd encourage you to visit our website, and there you can read our team's reviews. We have hundreds of 5-star reviews. And also note here that we're one of only 2 advisories nationwide that meet the National Council on Aging's standards of excellence. The award is based on our ethical approach and the way we train our advisors and how we counsel our members as they consider which coverage option to choose. And as you'll see, in Cook County alone, there are over 100 different options to choose as you approach Medicare. Today's presentation is purely educational, and it can really be broken into 2 parts. The first part is for those who are new to Medicare and want to understand the basics. The second half will address those who may have already started Medicare. Perhaps you've been on a plan for several years, you've seen a commercial, and you want to address whether that benefit might be a better fit and more than what you're getting now. So even if you've already started Medicare, please hang around because I'll have information for you during the second half of the presentation. Also, bear in mind that right now we're actually outside the window in which you can switch your plan unless a special circumstance applies, like you're moving, for example. If one of those special circumstances doesn't apply, then you really need to hang tight until the fall, which is when you see all the advertisements on radio and television. We have one too with our co-founder, Kobe, and his parents. And that's really when you can make a true plan change. But it's never too early to reconfirm that you're on the best fitting coverage. And that's something that I'll touch on near the middle and end of the presentation. So with that, here's a cartoon I like to show. It illustrates how confusing it is to navigate Medicare. The system has been built patchwork, which has created complexity, and that's why I'm here to break it down for you this evening. If you bear with me for the next 25 minutes, might even be less than that, I think you'll find Medicare is more straightforward than you might have anticipated. So what is Medicare? 2 parts to original Medicare, and this is actually right on your red, white, and blue Medicare card. The first is Part A, which means that you're under the hospital's roof eating the hospital's Jell-O. Part B is everything else. So if you take away anything from this presentation, just know that it's as straightforward as that. Part A is when you're at the hospital, it means you have a wristband. Part B is everything besides that. Now, of course, there are some technicalities here. Part A also covers hospice care and skilled nursing facility care for the first 20 days, for example. But really, it is that straightforward. And the system was intended to be that straightforward when it was created in 1965. And actually, the first 2 recipients of Medicare were President Harry Truman and his wife. Those were the very first 2 recipients. And they were signed, fact is typically fully prepaid. You pay for it through the Medicare payroll tax. It's 1.45% deduction. Part B is medical insurance. Part B is actually charged. There's an assessment here. It's $170.10 per month for 85% of Americans. What do you get in return for that premium? You get 80/20 cost sharing with Uncle Sam. This means that Uncle Sam picks up 80% of your visit to the doctor. You're responsible for 20%, and the sky is the limit. There's no maximum out of pocket. So with that, I want to introduce, and of course, you can see that Part B covers many other things too. For example, my mom just had a knee replacement and a hip replacement. She's bionic, and Medicare Part B covered 80% of each of those outpatient procedures. So what does Medicare not cover? Two things. First, there's no financial limit. In fact, the 20% obligation, people can go bankrupt. In fact, 150,000 people did in 2019, just because there's no maximum out of pocket to Medicare. So you can actually have medical bankruptcy if you don't have some type of additional coverage, which is something I'll touch on in a moment. The second big item that Medicare doesn't cover is long-term care. Long-term care is defined by the activities of daily living. For example, bathing, dressing, eating, or using the bathroom, even cognitive decline. Our team gets a lot of questions surrounding long-term care. Note, original Medicare provides no coverage for long-term care. There have been proposals in Congress to add an LTC component to Medicare, but the bills haven't left committee. And this is actually something I monitor closely in our weekly newsletter. And if you'd like to receive that, just put your email address in the chat, and I'll be sure that you're added to Thursday's edition. What does your Medicare card look like? It's red, white, and blue. It has your name on it, and it has a unique identifier. It used to be your social security number. That's no longer the case. It's now 11 characters consisting of uppercase letters and numbers. And you'll see that there are two dates on it, your Part A date and your Part B date. For most people, these two dates align if you started Medicare by way of turning 65. But if instead you opted to keep working past the age of 65 and start Medicare once you retired, then that Part B date probably isn't going to match your Part A date. And that's perfectly acceptable as long as a couple conditions apply. So what are the three decision steps that we walk our clients through? First, we help them sign up for original Medicare. Then we help them consider additional coverage. That's because, as you'll see, Medicare doesn't cover all of your medical costs. And then finally, we help them choose a specific plan because there are over 21,000 plans nationwide. And here we have a database that we built. It's proprietary, and it searches across every single one of these plans based on the doctors you see, the prescriptions you take, and the additional factors that are important to you, like dental, vision, and hearing. The best part is there's no charge. So step one, signing up for original Medicare. How do you sign up for Medicare if you're turning 65? Well, there's a 7-month initial enrollment period that begins 3 months before the month in which you turn 65 and extends 3 months after the month in which you turn 65. So it's a 7-month period cumulatively. Here I have an example. If your birthday is December 23rd, the earliest that you could sign up for Medicare would be September 1st, and the latest that you could sign up would be in March. Any questions on initial enrollment period? One special exception applies here. If your birthday is on the 1st of the month, then you actually get Medicare a month earlier, and it just moves up your 7-month initial enrollment period. So if your birthday is on the 1st of the month, definitely ask in chat, and I'll tell you when your 7-month initial enrollment period is. Now, what if you're getting Medicare by way of, what if you're past the age of 65, you still have work insurance and you want to start Medicare? Well, here you qualify for a special enrollment period so long as your employer has 20 or more employees. So if you lose health coverage from an employer with more than 20, then you have 8 months to sign up for Part B before you need to pay a penalty. There's a catch here though. You don't want to wait until after you've retired. And the reason is because you won't have coverage. There'll be a gap in your insurance. Amy, the answer is 20 full-time employees. Part-time employees do not count. And if you're working part-time actually, then you also likely would not qualify for a special enrollment period, and you would have to enroll in Medicare. This is actually something we help a ton of clients with who run small businesses. Even if the small group insurance is in their name, that's okay. They start Medicare and their employees can remain on their small group employee plan. It's also important to note, I've seen people get a lot of bad advice from their small group retiree benefits coordinator. It's really important to know that if you have fewer than 20 employees and your insurance is contingent on it, then you have to start Medicare. That's the rule. One more point, COBRA doesn't count as creditable coverage. So if you really like your small group insurance and your plan is to COBRA, know that that COBRA is not counting for the purpose of delaying your Part B or your Part D penalty. You're still going to be penalized if you miss your enrollment periods and you're outside the limitations. So there's some very important rules here that apply to people who have small group insurance. One more thing I'll note is that there's a perception that employer coverage is the end all and be all. But what I've seen is that the deductibles on large group insurance plans have gone up and up. In fact, some people even have high deductible plans now. If you have a high deductible plan and you contribute to a health savings account, health savings accounts are great, but know that you can't start Medicare Part A and can make contributions to a health savings account. You'll be penalized by Uncle Sam. You'll actually owe an excise tax and they'll count it as income. They'll count your HSA contribution as income. So know that you can't keep contributing to an HSA and start Medicare Part A. So what do we do when someone wants to keep their HSA? We just recommend that they delay their Medicare Part A. But here, note, this is about Part A, not Part B. So if you are contributing to a health savings account, please reach out, use that link that I posted there. It gets very technical here, and you actually need to disenroll from your health savings account. You need to stop making contributions, that is 6 months before the month in which 6 months before you intend to start Medicare, 6 months before. It's not the month before, it's 6 months before. Any questions on special enrollment period? All right. So then that brings us to step 2, which is considering additional coverage. Why do most people consider additional coverage? Over 75% of people now. Well, it's because original Medicare leaves you responsible for at least 20% of your medical costs. Remember, what you get for Medicare Part B for that $170.10 Part B premium is 80-20 cost sharing. Medicare pays at most 80% of your medical costs. You still owe 20% out of pocket. And what's more is original Medicare doesn't cover prescriptions, it doesn't cover dental, it doesn't cover vision, and it also doesn't cover hearing. So when people realize this, it's typically when it starts the conversation. That's typically when they reach out and want to start the conversation about how to comprehensively cover all the healthcare that they'll need. There are 2 ways to do it. One way is to keep the flexibility of original Medicare. So if you like seeing any doctor who accepts original Medicare nationwide, and most people like that flexibility, right? 94% of doctors accept original Medicare, and most people just want to see the doctors that they want to see. Then what we would advise there typically is a Medicare supplement. This is also known as a Medigap plan. And I'm sorry, I'm hearing an echo. If the Medicare supplement covers the 20%, it sits on top of original Medicare, and it covers the 20% that original Medicare otherwise doesn't. So what about drugs then? Well, what we would recommend is a standalone prescription drug plan if you want to go the Medigap route. Then there's Medicare Advantage. Medicare Advantage is heavily advertised on television. You see Joe Namath talking about Medicare Part C. Part C is actually administered through private insurance companies. So private insurance companies administer your Medicare benefits. Here's where you get into HMOs and PPOs, and you have to go doctor by doctor and confirm that each of them are in network with the plan. And this is where having a tool that searches across all plans is very helpful. What people love about Medicare Advantage is that they're more affordable than Medicare Supplement. Many of the plans have a premium as low as $0, and they come with additional benefits like prescriptions, vision, dental, and hearing. And I'm going to show you an example based on Cook County of each of these plans in a moment. Now, someone emailed in advance, I have a pre-existing condition. Can I be denied for a Medicare supplement? And the answer is yes in the state of Illinois. you actually only have a 6-month initial enrollment, a 6-month open enrollment period once you start Medicare Part B to sign up for a Medicare supplement. Otherwise, you're subject to underwriting, and it's a 50-50 proposition at that point. Even if you're healthy, there's still a prescription check. And of course, the carrier gets to ask about pre-existing conditions. So if you know that you want to go the Medicare supplement route, it's very important to exercise your open enrollment period and make sure that you sign up for the Medicare supplement plan before your Part B goes into effect. This is something we help clients with all the time. Amy asks from David, which plan covers regular visits? Both plans cover regular visits. Both Medicare Supplement and Medicare Advantage plans would cover regular visits. With Medicare Supplement, they're typically, for example, the most popular option is Plan G. With Plan G, there's no copays. With Medicare Advantage, there typically is copays when you see specialists. With many Medicare Advantage plans, there's no copay when you see a primary care doctor. But for a skin check, that would probably be a specialist visit to a dermatologist. All right. What about prescription coverage? Well, for prescription coverage, this is known as Part D. It was added to Medicare in 2003. So Part D, think drugs. It's paid for through a monthly premium, and there's also government reinsurance here. Now, note, if you go with a Medicare supplement, then we would typically suggest adding a standalone prescription drug plan, which costs about 2 fancy cups of coffee per month, or you could go the Medicare Advantage route, and that oftentimes comes with prescription drug coverage wrapped in as part of the premium. The reason to get it is, though it's technically optional, it's highly recommended, because if you sign up too late, and too late means 63 days after you were supposed to sign up, then there's a lifetime penalty associated. And the lifetime penalty is very annoying to pay. It's only 35 cents per month for every month that you were supposed to enroll, but it actually really can add up. I have seen people with $75 Part D penalties because they were supposed to sign up for prescription drug coverage and they just missed their window and didn't realize that they needed to. And then when they want to have prescription coverage, let's say they weren't taking any prescriptions, then they owe that penalty. So even if you're not taking any prescriptions at all, it's highly recommended to sign up for it, because you might need prescriptions later on. That's the whole purpose of insurance. Even if you don't need it in the first place, you might need it later on. And so that's why it's recommended to sign up for it. And I've already covered the 2 ways to get it, though I'm happy to go into further detail here. What really matters, though, is the prescriptions that you're on, the pharmacy that you prefer, and then to remember that these plans change each and every year. So it's important to reconfirm that you're on the lowest cost, most comprehensive coverage. With that, brings us to our final decision step, which is choosing a specific plan. Now, take a look at Cook County. There are over 54 different options for Medigap and 81 different options for Medicare Advantage. So all in, there are 135 options for 2022 in Cook County alone. Imagine if you live in Lake County, for example. The options are different. The plans differ for you. So this is why it's so important to go plan by plan to compare benefits, because what's changing each year are your doctors, the doctors you want to see, the prescriptions that you take, and then the plans themselves are changing each and every year. For example, Illinois is actually becoming an increasingly, especially Cook County, increasingly competitive state, because it has a number of, the census actually showed that it was actually one of the fastest growing populations for older aged adults, surprisingly. And so then there's a lot of competition across Medicare Advantage carriers in Cook County. We're seeing more and more small carriers enter the market, and these plans are very feature rich, very benefit rich, and it's advantageous to do a complete review to see if you can be getting more from your health insurance. Here are the factors we typically go over in an initial 15-minute review. First, the cost of the plan, whether it's Medicare supplement. If you're turning 65 in the state of Illinois, it'll typically cost about $105 to $115. To Medicare Advantage, which over half the plans are $0. Then what we'll also look at are the doctors you want to see. We'll make sure that they either accept original Medicare if you're leaning towards Medicare supplement, or if you're going the Medicare Advantage route, that they're in network under your plan. That's very important. Then we'll talk about prescriptions, what prescriptions you take, dosage, frequency. It all affects price, brand name, generic, you name it. And then finally, the location and lifestyle preferences that are important to you. For example, for my mom, I know she really wants to visit Arizona. We got her out here 2 weeks ago. So for someone who's traveling, or maybe they're even planning to be a snowbird, it's very important to think about Medicare supplement there, because under a Medicare Advantage plan, you're out of network under most plans once you're 50 miles outside of your home base. So your location and lifestyle preferences really matter here. And know that the time to review this, there's no, the time in which you can make changes is the fall, but really it's never too early to start the conversation. Even if you're 61 years old, it's a perfect time to start thinking about Medicare. And working with an independent advisor can really help here. Chapter is an example of one, and there's no charge to work with us. So with that, I wanted to open it up to questions. My phone number is there, 970-401-6455, and also my email address, ari@askchapter.org. What questions do you have?
I have a question about somebody's ability to, if they're moving from one state to another, and in their the original state they lived in, they had a Medicare Advantage plan. What rules apply when they move to another state about selecting either a new Medicare Advantage plan or a standard Medicare supplement?
Great question. Two windows will apply, at least two. The first is you'll get a special election period to choose a special enrollment period to choose a new Medicare Advantage plan in the area that you move to. Second is it's possible that you might qualify to switch to a Medicare supplement under a guaranteed issue right, which is really, if you wanted a Medicare supplement and you're moving to an area in which that's an option for you, it's very important to act at the time that you move. Otherwise, you'll have to answer questions about your health history and you would be you could be denied. Whereas if you know that you're moving, then it's something that you can plan for, and we can see if a guaranteed issue right applies. So you'll have maximum flexibility to either choose a new Medicare Advantage plan, or you may have a guaranteed issue right to get a Medicare supplement.
Can I ask a question?
Of course.
Hey, Ari, how are you?
Good. How are you?
Good. Can you, you're not captive, right? You're an independent agent?
Yes.
Or are you captive?
Independent. Independent.
Okay, that's great. And then if you want to switch from year to year, can you switch an open enrollment from a supplement to an advantage, or back and forth? Is there rules around that? Like if I don't like the advantage, I can go to the other, or is that is that like a qualified event, or you can do that anytime? As you renew it from year to year, you can switch?
Great question, Edward. So first, we're appointed with over 50 insurance carriers, but it doesn't affect our recommendation. Our advisor's compensation doesn't vary based on the carrier that they enroll you with, or whether it's a carrier that pays chapter. What matters is that they make the recommendation that you go with. And so what they do is they provide a short list of recommendations to you. On your question of Medicare Advantage, on switching between a Medicare supplement and a Medicare Advantage plan, the time to do that would be in the fall during the annual enrollment period, which is between October 15th and December 7th. Now, if it's the first time that you're switching from a Medicare supplement to a Medicare Advantage, and you signed up for that supplement when you were first eligible, then you actually have a guaranteed issue right to go back to the Medicare supplement if you're unhappy with the Medicare Advantage plan. That guaranteed issue right lasts for 1 year, and it's strict. It's a strict 1 year period. Of course, if you like the Medicare Advantage plan and you just want to choose a different Medicare Advantage, answer questions about your health history if you wanted to get another supplement.
You're doing a good presentation. Stu, you're on mute.
Any other? Oh, hi. Thank you so much, Frederica. And here, I'll repost the link again if you want to discuss your situation in private.
Hi, I have a question.
Yes, Ruthie.
Hi. I just turned 65. I'm on my husband's insurance. He is the employer and he still plans on working for another year or two. At what point do I need to start the process of figuring out, what insurance I'm enrolled for?
3 months before the month in which your husband intends to sign off their coverage.
Sorry about the
The work
dog.
coverage. Oh no, I have 2 dogs too. He has a great bark.
All right, thanks.
How does chapter stay current with all the different changes from year to year?
We have a database. It would be impossible to do it otherwise because there's over 21,000 plans. And so we're constantly refreshing our database with the new plan information that's available. Plans can change even mid-year. Many people don't realize a plan's network of doctors can change mid-year. They don't have to wait until the annual enrollment period or until next year's plan rolls out to change. So it's very important to track these changes. And it's something that we do. And we actually try to get in front of it. So if we notice that a doctor, for example, is leaving a plan network, then we will start the conversation with a client who might be seeing that doctor. I think on the question of plan changes, it's also important to note that when each year the plan's benefits typically change a little bit at least. And so with our clients, we always have the fall review. We always do a fresh review in the fall to make sure they're on the most comprehensive, lowest cost coverage.
And if you get a disease during the year, do you get to change anything or you're stuck unless you move?
A disease, unfortunately, wouldn't qualify for a special enrollment period, usually, unless it's a very specific one. There are some chronic illnesses that might qualify for a certain subset of plans. For example, lung, kidney, heart conditions may qualify for a chronic special needs plan. But typically, there wouldn't be a special enrollment period. For example, if you contract COVID-19, let's say, and have complications. On I think there was a second part to your question. Could you remind me?
No, that was the answers. I just wanted to know if the disease meant, unless you move, if you move, then you get to change plans.
Yeah, so if you move, that's one of the special enrollment periods. There's others too, but moving is one of the biggest ones. Another common one would be if you're for Ruthie's situation, for example, is she would be starting Medicare after the age of 65. And further special enrollment periods might be if your insurance carrier goes belly up, which does happen. So it's actually something our database looks at, is the creditworthiness of the carrier that we're recommending.
And what if you move from state to state? Do you have to keep reapplying or how does it follow you?
It depends. If you're just moving state to state and you've already selected a Medicare supplement, then you would just let your insurance carrier know that you moved states. That's it. You would update your address with the Social Security Administration because we don't want you to miss any statements. If you're on a Medicare Advantage plan, though, then it's likely that your plan won't be offered in the state that you're moving to.
Right. So what do you do?
Well, that's exactly where we come in, and we do a new search based on the doctors that you might want to see in the new area that you're moving to, the prescriptions that you take, and the plan benefits that are available, because the plans vary county by county. Even Cook County to Lake County has a different subset of plans.
Is Illinois' pre-existing condition law the usual law, or is that unusual for a state not to cover pre-existing conditions?
Illinois is is a little bit more generous actually than other states, because Illinois has a limited guaranteed issue, right? In most states nationwide, I would say 44 out of 50, it is a 6-month window in which you can obtain a supplement, a 6-month window. Edward, I saw you had a question.
What's the maximum out of pocket? Does that vary by the plan, or is that just on the medical advantage plan? Or is there out of pockets on both original and advantage?
The only out of pocket you would see on a Medicare supplement would be the Part B annual deductible of $233. So it's you will not see a Medicare approved expense if you're on a Medicare supplement plan G after the first $233. With a Medicare Advantage plan, there is a maximum out of pocket, which is actually really important because there is no maximum out of pocket with original Medicare. So whether you choose Medicare supplement or Medicare Advantage, you're still a lot better off than you are under original Medicare, where sky is the limit.
Hi, this is Stan Friedel, Ruthie's husband. I have a question. If I have an HSA savings account, because we have a high deductible plan, can we keep it open as long as we don't contribute to it, or do we have to get rid of it? Because I've accumulated money in there over the years.
Of course, you get to continue to you can use your HSA for qualified medical expenses. You can't make fresh contributions, but you can use all the funds that you've accumulated. The only thing you can't do with it is use it to pay for your Medicare supplement premium. So you can use it to pay for your Part B premium. You can use it to pay for your prescription drug premium, but you can't use it to pay for your Medicare supplement premium.
And the other question is, when do you then generally sign up for Medicare Part A?
Well, if I'm hearing you right, Stan, you're contributing to an HSA right now.
Correct.
And you're planning to retire in 1 to 2 years, Ruthie told me.
Right. Good
Okay.
memory.
Then you want to discontinue contributions 6 months before the month in which you intend to retire. This is a hard and fast rule. The reason why is because the Social Security Administration, by regulation, backdates your Part A effective date to 6 months before the month in which you applied to start Medicare.
Okay.
So you want to discontinue contributions 6 months before the month in which you intend to sign off from your work coverage.
And then one last question. Why is there a difference? It sounds like there's a difference in time when you sign up for Part B versus signing up for Part A. When you sign up for both at the same time?
For you, yes. For others, no. And so first, most HSAs are incredibly valuable, but they're not the norm by any means. For most people who are just on a standard employer health provided insurance, and they're not on a high deductible plan, and they're not contributing to an HSA, it's actually to their benefit to take Medicare Part A, because the Part A will be secondary insurance to their employer group coverage.
Okay. So can you sign up for, I'm sorry, I'll stop asking questions. Can you sign up for Part A while you're still working then?
Absolutely. That's the norm. The norm is for someone who's still working past the age of 65 and they're not contributing to an HSA, the norm is to take Part A and decline Part B until they're ready to sign off their coverage, their work provided coverage.
Okay, thank you very much.
I'm sorry, it's Marlene.
Hi, Marlene.
Hi, I just about the Part A. I mean, I'm way past 65, but I was still working when I was 65, and I just got a notice. I didn't do anything, and I just got notice that I was, got a little card in the mail and said I'm, have Part A.
Right.
Is that the way it happens? I work for the feds, but I did nothing. I didn't sign anything. I didn't do anything. I was just, employed, and I got that notice. Is that something that's normal?
Yep, that's right. It's an administrative process. As long as the Social Security Administration shows that you've paid your 40 quarters, which is 10 years
okay.
of your Medicare payroll tax, and they send you your Part A card, And then, of course, Marlene, what we'll talk about. when
Right,
we
I didn't
speak-
want to get to that other question, but this one was just because of Part A. I mean, I was just surprised. I didn't do anything. And I guess just when you're 65, and since I've been working, they just send you a card. I mean, that's why because a lot of these other people were indicating they had to apply for it. And I didn't, and I just was curious as to the difference.
Yeah, do you see how your situation will be different than Stan's though? Stan doesn't want to do Part A. If he did Part A, he would get his HSA contribution would be treated as income, and there would be a federal excise tax.
Oh, okay. I was just, yeah, I was just surprised, you know, one day I had Part A, I didn't do anything, which,
Yep,
Weird. Okay.
Marlene, that's the most common situation though. The government will just send you a card with your Part A date. If you're not taking Social Security, if you are taking Social Security, then they'll send you your red, white, and blue card with a Part A and a Part B date on it, and there'll just be an opt-out form for Part B. So if anyone is taking Social Security and they're not yet 65, know that you're automatically enrolled in Part A and Part B.
okay, but that didn't, all right, thank you. I was just interested in the difference because that was sort of weird. Okay, thank you.
All right, who else? Alan, Michael, David, Chip.
You had talked a bit about that you couldn't, if you were part-time, it didn't count. And I have a question along those lines. What if you're not working at all, but you're on your spouse's coverage?
That's fine. That's fine. Yeah, your spouse's coverage counts. That works.
And in order to do all the stuff to get it figured out, for Medicare purposes, how much time should you give for your retirement? In other words, when should you start telling people you're going to retire? Do you need 2 months to figure this out, 3 months to figure it out? What would be, I mean, it sounds like doing it on 2 weeks would notice.
2 weeks is not recommended. 3 months is ideal. 2 months is fine too.
2 to 3
Month of is tough. Month before is tough because
Okay.
Social Security Social Security used to have experts to address these questions for you. If you would just go to your local office, they would have someone who knew the rules inside and out. No longer the case. Now it's very difficult to even get an in-person appointment at your Social Security office, and they don't have an expert that you can speak to about the process of starting Medicare Part B. So here at Chapter, we walk you through the process of getting your red, white, and blue card. And as you can see, for example, in Stan's situations, with an HSA, we know the rules inside and out. And it's something I take a lot of pride on training the team on.
You
When you
know,
were talking-
Laura?
when you were talking about the different criteria for choosing plans, you didn't say anything about how the quality of the rating, like the financial wherewithal of the company. Is that something that is not important?
He said he would.
It is really important to look at, because you not only want to look at the credit worthiness of the carrier, you also want to look at how the carrier will raise premiums as you age. So what we do is we look at two things. We look at one, how aggressively does the carrier raise its rates, taking your age from age 65 to 85. We look at it over a 20-year index and then rank each carrier against each other. And then what we also look at is the credit worthiness of the carrier. We typically only recommend carriers that are A-rated or better.
you also look at the star ratings when you're doing that, or that's more of a quality of care issue? I mean, what kind of quality you're getting with these companies? Is the star from CMS ever come into
Yeah.
effect?
Edward, the star rating pertains to Medicare Advantage plans and prescription drug plans. The credit worthiness of the carrier pertains to Medicare supplement plans typically.
Okay.
But both star ratings is definitely a factor to look at. Oftentimes people actually put a little bit too much weight, in my opinion, on the star rating. And I'm happy to unpack further what star ratings are.
Okay.
But also let me note this: one special enrollment period is if you want to switch to a 5-star Medicare Advantage plan. So that actually is a special enrollment period. If there's a 5-star plan offered in your county, you can switch to that 5-star plan for 51 weeks out of the year.
Interesting. And one
Yeah,
last thing.
it is really interesting.
That is interesting. Do you know, do they give you any kind of discounts? Like I'm thinking of car insurance, or if a household discount, if you and your wife go with it, or is there really none of that in the industry? You know, if you have more than one, like a family sign up versus an individual, or is
I'm glad you brought up household discount. There's one, yeah, we do. There is a household discount on
Really?
for many Medicare supplement carriers offer a household discount. For Medicare Advantage plans, it's not, there is no household discount.
That's interesting. Okay, so based on who signs up and all that, you could talk through that if we talk to you offline. Okay.
Yeah, it's something that we look at closely. It affects the price. For example, there's a carrier in Illinois that has a 14% household discount for Medicare supplement. It actually makes it the lowest cost plan in the state if you have someone, if you have a spouse. There are other carriers that instead define household more generously than that carrier, but they offer a slightly lower discount. It gets really interesting. And again, this is something that we can see in our database.
I have another question. If I'm still working and my wife has turned 65, is she then now enrolled in Part A? Or does that have to wait until I'm done working?
Stan, hold on. Let me unpack your situation. So are you, Ruthie is turning 65?
Yes.
Stan, are you already past the age of 65?
No.
Got it. So Ruthie would just do nothing, right? Because you don't want to start, you're contributing to an HSA. I imagine you're making the family contribution, right?
Okay.
Right. So you don't want Ruthie to take Part A.
Okay. Is there a point that being part of Part A is more valuable than putting the maximum allowed for the HSA in the year?
Absolutely. So it's a great question. What we do is we do an apples to apples comparison between your work provided insurance and, sorry, my dog just woke up, between your work provided insurance and what you would get by starting Medicare. So with a high deductible health insurance plan, you're going to have a huge deductible, right? Over $6,000, I imagine. Maybe it's even close to $10,000. With Medicare, your Part B annual deductible is $233. So it's definitely worth doing a comparison over what the premium is, if you have one, on your work provided insurance versus what your premium would be if you were to start Medicare.
Okay, thank you.
Because what you could do then is Ruthie could start Medicare, and then you could just make the individual HSA contribution.
Thank you.
Ari, can I ask a question?
Of course, Michael.
So first off, I apologize. I came in a little bit late, but one of the things that I was unclear that you were talking about, now I'm 63 and my wife is a little bit younger, so we are both working. We both have access to company provided health insurance, and actually I retired from a financial institution, took early retirement, so I still have access to that retirement policy as well. My work policy is actually a really good policy. It's not a high deductible, which I was surprised at. So if I continue to work after age 65, and I'm at this company and they still have that Blue Cross Blue Shield policy, typically, do you find that to be a better alternative than Medicare, and you want to stay with private insurance as long as you can? Or it is a more flexible option to basically get into the Medicare system as early as possible?
Michael, each plan is different. So it really depends on how strong your BCBS plan is. Here, I would want to see the summary of benefits and the evidence of coverage to look through it and to see what you would get.
Got it. So basically, it's a fact-dependent situation, and it's possible that my Blue Cross Blue Shield policy will be a superior option for a period of time. And I'd want to keep that and not do the Medicare, but at some point then move over there. And then you had mentioned the fact that you cannot be working part-time. How do they define part-time?
No, you can certainly be working part-time. It's just whether you then qualify for whether that part-time work status would qualify you for a special enrollment period to start Medicare Part B.
So
there are tons of people who are on Medicare and work part-time.
I got you. But if you are working part-time and you still have full health care coverage from Blue Cross Blue Shield, then again, it just requires someone to sit down and make that analysis between the various policies as to what your best option is. And within the Plan A, Medicare Advantage and everything else, there are a lot of options to choose from. And, you know, when you talk about options again, is there qualitative differences for companies that are kind of similarly priced? I mean, like what are some of the things that you would look at if you don't have any medical conditions besides necessarily, I guess the doctors and price become the two primary criteria?
Well, Michael, it's also important, even though one might be perfectly healthy at age 65, it's also important to consider how their healthcare needs might change as they age, what chronic conditions they might want to take precaution against, and also what their travel plans are in retirement. For example, if you are a snowbird, or if you just know that you want to visit grandchildren, for example, then you might lean towards one type of additional coverage versus another. These are all things it's important to consider, not just what your healthcare needs are at that moment in time, but also how they might evolve.
I got you. All right. This was very helpful. Okay, thank you.
Yeah, of course. And feel free to I would love to look at your Blue Cross Blue Shield plan. You're a few years away though, it sounds like. So
I am, but I'd love to kind of get an idea of some stuff. Yeah, I would love to contact you and just start to understand what some of the steps are that I should be thinking about. But thank you.
all right. We're at the 50-minute mark. Amy, are there any other questions that someone is pinging you about?
Not yet. Please note that Ari did put his email and his phone number in the chat. So please write it down if you wish to contact him separately. The video recording will be on our website within a couple of days. And if anybody has other questions, please feel free to reach out to myself or Ari.
Any other questions?
Ari, I just want to say thank you very much. This is very helpful.
Thanks,
And we'll be in
Ari.
touch.
Yeah, we'll be calling.
Thank you.
Thank you.